Richard Tytus. He's an associate clinical professor at McMaster University. He's also the co-founder of Banty.com. Doctor, great to have you on the program.
Thanks, Angie.
When we talk about this, the virtual doctor, the virtual medical appointment, if you will, talk to us a bit more about this platform, choosing to create this platform, and I guess, beyond perhaps what we're seeing in this pandemic.
Yeah, so one of the issues is that Canadians aren't seeing their doctor, and they're not seeing their doctor because they're afraid to go into the office. They're afraid to do that physical interaction. So that's why we developed Banty. So Banty.com, you can come and see your doctor virtually, safely from your house. You can use it on your smartphone. You're not exposed, and you have access to the care when you need it.
So walk me through then, if, for example, if I had I'm your patient and I've got a concern, or perhaps maybe it is more of a routine checkup. Walk me through what that would look like.
Okay, so essentially, you make an appointment and we set up a time that's convenient for you. So many times, Angie, you could be saying, hey, I've got a break between 7 and 8. Can I see you sometime in there? So we accommodate you, and you can just go on our app. Our app is Banty.com. You don't download it from the App Store or Google Play, and then I will see you at the assigned time. So easy, so great access for you, and we can address your concern, because what's happening now is my patients aren't coming in. The Canadians aren't coming in to see the doctor. They're not being diagnosed with, let's say, colon cancer. Their diabetes isn't being taken care of.
And that we know is a big concern, as we know there is already a backlog with regards to medical procedures, surgeries, et cetera. And now, as you say, if patients aren't checking in with their doctors to make sure that they are okay, we then could be looking at what could be perhaps a situation that could have been taken care of medically early on has now become a much larger medical issue. How does this sort of now will affect and help this backlog that we're seeing during the pandemic?
Well, what's happening during the pandemic is because we're not seeing patients, we're not controlling their diabetes, we're not controlling their heart disease. So what happens? So after the pandemic, there's going to be a massive backlog. People are waiting, but you can't wait. If you can't see your doctor physically, now you can see them virtually. It's time to employ the new technologies that we have available to us.
What's the reaction been like, Doctor? That beyond just a phone call, but actually being able to see that trusting, friendly face, your doctor that you look to for that sense of relief.
Well, the Canadian Medical Association did a survey, and patients loved it. They love this type of interaction. And when I see my patients on Banty, afterwards I say, hey, would you like to come into the office for the next visit? 90% say, that'd be great, doc, but I love this platform. It's so much more convenient for me.
Yeah, and certainly would be for a lot of those patients that aren't able to get to your office because they may be homebound for a number of medical reasons. Well, you know what, as you say, embracing the technology and making sure that doctors are doing everything they can to treat their patients. You're certainly doing that. Dr. Richard Tytus, co-founder of Banty.com, also a professor at McMaster University. Doctor, thanks so much for this. Stay safe, and we'll talk to you again soon.
Take care.
You too.